Glaucoma is a group of conditions that encompass damage to the optic nerve, usually because of eye pressure that's too high for that eye to handle. It can be different between eyes, it varies widely between patients, and there are multiple subtypes of glaucoma, but if we think about it in terms of four major categories, it makes it easier to understand. The first category that we will divide glaucoma into is primary or secondary. Primary open-angle glaucoma is that which affects over 2 million Americans, projected to be over 3 million Americans by the year 2020, and it's the most common type of glaucoma. It has no known cause, but it is related to a balance between the production of fluid in the eye and how quickly it's drained from the eye. Secondary glaucoma can be due to multiple different entities or diseases that may cause those structures within the eye to function less ideally than you'd expect. The treatment for most subtypes of glaucoma is the same. You try to lower the pressure in different ways, either with eye drops or laser or surgery. The second way to classify glaucoma is to call it either open angle, narrow angle, or closed angle. Narrow angle glaucoma, which is more common in patients who are farsighted, but can occur in many different types of patients. And in these particular patients, their drainage system is physically closed off and is at risk for closing off completely, leading to a very high spike in eye pressure. So the treatment for narrow angle or even completely closed angle types of glaucoma is very different than the treatment for open angle glaucoma. The third way in which we classify or categorize glaucoma is how long has it been going on? Is it acute? Did it just happen? Or is it chronic, or has it been going on for a long time? And chronic open-angle glaucoma is the most common by far. Lastly, you'd want to classify glaucoma as being either mild, moderate, or severe, because again, the treatment options for each subtype is going to vary. A patient with very severe glaucoma that's progressing despite drops and having had some mild laser therapy may be more willing to take those risks associated with bigger surgeries because they have more to lose. What ends up happening is that optic nerve, which is the cable that connects the eye to the brain, is the most susceptible part of the eye to damage from high eye pressure. So when the pressure is elevated, for whatever reason, the end result is that the optic nerve is going to lose some of the nerve fibers that control vision. And when this happens, certain parts of your vision, usually the peripheral vision to start with, start to go away. Patients don't notice this process occurring at an early stage because it is not a part of their vision they may use all the time. So glaucoma has been referred to as the sneak thief of sight because it may take the vision away for a long time before a patient actually notices it. This is the reason ophthalmologists recommend having a vision exam at age 40. Make it part of your routine, such as going to get a colonoscopy or going to get a mammogram done. An eye exam is a good idea at the age of 40 to screen for these things. Earlier screening is recommended for patients with other risk factors such as family history. If you're looking at glaucoma in terms of the subcategories that we discussed earlier, such as primary open-angle glaucoma, patients who are generally older than the age of 60 are going to be at a higher risk for developing that type of glaucoma. There are other risk factors, though, for glaucoma, the most prominent of which is family history. So if there are family members with a history of glaucoma, you are automatically more susceptible to developing such a glaucoma. So it's important to note that one of the most important risk factors for glaucoma is intraocular pressure. And I get a patient question all the time about what is my pressure, how is it doing? Oftentimes my patients will ask me this even before they ask me what the results of their visual field testing or eye exam look like. And it's important to understand that eye pressure is a guiding tool for us, but our treatment is not dependent just on the results of eye pressure, and even our diagnosis of glaucoma is not dependent on just the results of eye pressure. It's a multifactorial disease that we put all the pieces of the puzzle together before making a final diagnosis and recommending any particular treatment options. I'm Bodhireddy. I am a glaucoma specialist at the Spokane Eye Clinic.